Imagine testing positive for COVID-19 and then reporting right back to work. That's the stark reality facing healthcare workers in one Belgian town where hospitals' ICUs are filling up. This all comes as nearby France and Germany impose new lockdowns. While here in the U.S., cases surged over the summer. That was not the case in Europe. So how did the virus get so out of control there so fast? James Longman reports.
Belgium heard the second wave coming, but it's hit harder than anyone expected. This is Liège, the city where more COVID tests come back positive than anywhere else in Europe. Patients sharing hospital rooms, a healthcare system on the brink of collapse.
It was a distressing sound. The patient inside is clearly in some discomfort. This small room, 2 COVID-19 patients are being treated, trying to make sure they don't end up in the ICU. But as we're standing here, we're seeing ambulances roll up outside through the windows.
Belgium is now in the midst of a deadly second wave of COVID. The positivity rate in Liège is a whopping 41%. Health professionals in the country are sounding the alarm, warning if the situation persists, it's only a matter of days until the country runs out of ICU beds.
And this is what you call the war zone line.
Yeah.
That's the war zone. Do you really think that the second wave is going to be worse than the first?
It is. It's already worse.
It's already worse.
Oh, yeah.
Staff shortages are so severe, Dr. Sacha Guyssen is one of the many doctors who had to keep working even after he tested positive for the virus.
And it's an ethical dilemma, really. And, usually in the ethical dilemma there is one bad option and one is worse. And sometimes we feel that, is there any more good option?
There are no more good options.
No. But because we have to take care of these patients, and it's better having you COVID positive, asymptomatic with your complete protective equipment than nobody.
Officials in Belgium relaxed the more rigorous safety measures that had kept them safe, and now they're paying the price. They were forced to reverse course, imposing a new wave of restrictions, a national lockdown now on the horizon. Belgium is recording the most COVID cases per capita in Europe and a death rate second only to the Czech Republic. The country Minister of Public Health visibly emotional after an official visit to a hospital.
Ce que j'ai vu ici, c'est très douloureux.
What I've seen here was very painful. I find that very shocking.
Et donc, il y a la souffrance des patients.
There is the suffering of the patients, of the loved ones who are invisible. There is huge commitment here, so it's hard. It's hard.
Donc, oui, c'est dur. C'est dur.
Record daily cases are haunting European countries. In France, President Emmanuel Macron announcing a 4-week nationwide lockdown.
Débordé par une deuxième vague.
Overwhelmed by a second wave that we now know will probably be harder and more deadly than the first.
We were in an ICU in Lyon, France last week and saw firsthand how swiftly the tide can change.
In one 24-hour period, they saw over 30,000. Now, that's because a lot more people are getting tested, but they are seeing an increase in hospitals as well. And this ICU went to 75% capacity. They were so worried they had to increase the number of beds on this ward.
In Germany, Chancellor Angela Merkel shutting down restaurants, bars, gyms and theatres starting Monday.
If the pace of infections continues like this, then we'll reach the limits of what the health system can manage within weeks.
Officials are pleading with an exhausted population. The economic and emotional toll of further lockdowns is too much to bear.
It's a shame because I personally need cultural activities to clear my head to get through the situation. I do not see where the risk is when we go to the movies or the theater while respecting the safety measures. I do not understand.
As the virus continues to prey on the elderly and high-risk populations in Belgium, a silver lining. Florent is a 75-year-old patient on the mend. He may not have survived in March, but better treatment now means he will. And it's his birthday today.
Qu'est-ce que vous souhaitez le plus pour votre anniversaire, monsieur? Retourner chez vous. I said, what do you wish the most for your birthday? It's his birthday today. He said, just to go home, really.
Better care, but with climbing numbers, hospitals across Europe are worried they won't cope this winter. James Longman in Liège, Belgium, for ABC News Live.
Our thanks to James for that. And still ahead here on Prime, the horrific terror attack, 3 people killed inside a church by a knife-wielding man. Now France has issued its highest terrorism threat level. Our look at the first case facing this new Supreme Court, mixing religious liberty and non-discrimination against LGBTQ families. Can a Catholic Church social service agency be denied contracts because it refuses to help same-sex couples adopt? But first, our tweet of the day. Today, October 29th, is Latina Equal Pay Day. It marks the 1 year, 10 months, and 29 days that it took the average Hispanic woman to catch up with what the average white male earned in 2019. More on the economy right after the break.